Welcome to the Empowered Aging Podcast. Your host is Michelle, a physical therapist passionate about helping older adults stay active, mobile, and independent. Let's dive into today's topic.
I recently posted a video, a reel on Facebook, demonstrating some hip exercises. And I received several comments from people who were concerned about doing them because they had had a hip replacement. And they thought, oh, I can't do that. I was told not to cross my legs. And I can totally understand their concern and sometimes their confusion about what those precautions are. So I wanted to go over what those common precautions are and when they need to be applied. So first off, there are different ways of doing a hip replacement. When I started practicing therapy over 30 years ago, it was only done through an incision at the back of the hip, the posterior approach. And with those, they always had very strict precautions. But now they're starting to do more from the front or maybe from the side. And those have much fewer precautions, if any. And it really does depend on the physician and on the patient's body. The physician will tell you what those precautions are. The problem is that sometimes they're really general in those precautions. So I want to explain what they generally are. You'll often be told you're not allowed to cross your legs. Crossing your legs, though, can be done in different ways, right? There's the ladies' way, crossing, or there's the men's way, crossing. Very different when it comes to the hip. So this first way that I showed you, the women's way, is the way that generally you are not allowed to do after a posterior hip precaution. That combines the three things they want you to avoid. Now, temporarily, please keep in mind, these precautions are almost always 99.99% of the time temporary. 6 to 12 weeks, depending on the person, depending on the surgeon. But they are not meant to limit you for the rest of your life. So they ask that you not bend your hip, bringing your knee upward beyond 90 degrees. So if I'm sitting upright, my thigh is parallel to the floor. That's 90 degrees. Now, if I'm leaning back, I can lift that knee higher, technically, but still not greater than 90, because it's all relative to my body. Okay? The other motion they don't want you to do is cross your legs or cross your leg over midline. Okay? So if I'm moving my leg inward across the center of my body. Now, that might not even be a crossing of the legs. I could have this leg way out here and move this leg over. It's still across the midline of my body. So that's a no-no. And then the third one is rotating the hip inward. Could go outward, but not inward. And so crossing the legs kind of combines all of those movements when you sit like this. The problem with these movements is that every one of them causes the ball of the joint to come outward of the socket, which normally is fine. That's just it's designed to move around. But when you've just had that hip surgery, the posterior approach, the muscles and tendons around the hip joint are more compromised. They're weakened. And so that hip is more likely to pop out. But with strengthening and stretching and all the rehab that should happen after the surgery, that gets restored and the hip becomes stable again. Hence, precautions are no longer required. Now, this way of crossing the legs does not break precautions. I am not flexed past 90 degrees. I am not internally rotated. And I'm not crossing my leg over midline. This is actually placing the head of the femur deeper into the socket. So it's really a very safe movement, albeit probably uncomfortable at first, but this is not disallowed unless you have different than the standard precautions. As always, I always want you to check with your doctor or the physical therapist who you are working with to fully understand your precautions. But I think it's important to really get the details and not just think crossing legs and always think this way or this way, okay? Understanding what you're allowed to do and what you're not allowed to do is very important after surgery. Likewise, when you're allowed to start resuming those normal movements. At your follow-up appointment at about the 2-month mark, the doctor will likely tell you that you can resume normal activities. At that time, be specific. Ask him, what movements do I need to avoid? Generally speaking, they're going to tell you, you can do just about anything in moderation, right? So they might say, okay, yes, you can bend down towards your feet, but maybe not do it combined with the crossing, right? When you combine those different precautions at first, it can be a little bit tricky. So knowledge is power. Don't just assume I have to follow these precautions for the rest of my life. That is not the way they are intended. So with that being said, I want to take you through some of the basic exercises that I would recommend after a hip replacement. And I think this is important because more and more now, doctors are not sending people to therapy after hip surgeries. And I think that's a shame. Surgeons are great at the surgeries. They're doing wonderfully with them. The surgery itself is advancing so well, and people are moving so much better after these newer surgeries. But those muscles are still compromised. People still need to regain normal flexibility, normal strength in order to restore normal movement patterns. Before you even had the surgery, you were probably walking with a bit of a limp. Shifting your weight a little more to one side, taking shorter steps, maybe going upstairs just one at a time. And all of these things become habitual. And without proper guidance and safe progression, you risk not returning to normal movement. Either you try to push yourself too fast and can injure yourself, or you don't push yourself enough and you never get back to those normal movements because those habits have become ingrained. So that's what therapy can do. It helps to restore normal flexibility, normal strength, so that you can start moving normally, which is more efficient. As soon as your body starts adapting to pain, compensating, the movements become less efficient. So other muscles are working in order to create the movement that you're trying to do while avoiding certain ones that cause pain. And inefficient movements, compensatory movements, can lead to further issues down the road. Back pain, knee pain, runs the gamut. So let's go over some exercises that you can do to restore normal movement. The heel slide exercise helps to loosen up the hip and gently get it moving again. It helps to be on a more solid surface, like a mat like this. If you're in your bed that's really soft, you can place something harder under your foot, like a cookie sheet, or maybe just a spare piece of wood that you have around the house. Or if you can't find anything else, maybe just a plastic bag that will reduce some of the friction. So simply sliding your leg up and down, just getting that hip loosened up, and helps to reduce some of the swelling that you might have in there as well. Now I have this strap around my foot, which can help if I don't feel like I have the strength to move it, but maybe the hip could actually move more. The strap can be helpful. If you've had precautions, you would need to stop at the 90-degree mark. But if you have no precautions, feel free to bend it up as far as you can. Now, I would like for the strap to be used as little as possible, using the muscles of your hip as much as possible. But at the same time, we're not looking to strain the muscles. So you do what you need to do. The glute squeeze is an isometric exercise, which means nothing really moves. Usually, people feel more comfortable with their knees up, but if you prefer to have them down, that's fine too, whichever position is comfortable for you. The idea is simply squeezing those butt cheeks and releasing. The gluteal muscles are so important for walking, standing, posture, going up and down stairs. So regaining that strength is so important. So simply squeezing the butt cheeks and releasing. Holding for anywhere from 2 to 5 seconds and release. A lot of people, as they age and start moving less, particularly if they were having pain and moving differently, these gluteals just kind of forget how to activate. And so it's important that we teach them what they need to do. Now, once you feel like you've got that glute set down pretty well, we advance on to the bridge. With the bridge, I want you to try to flatten your back a little bit, stabilizing your core, activating here. Then tighten your butt cheeks, your glutes, and lift through both legs and back down. It's not important that you raise your hips very high, just getting some movement. Again, tuck the hips, squeeze the butt, and lift. And lower. I see a lot of people do this exercise incorrectly using their back. So without this tuck, when you start to lift, if you feel it in your back, something's not quite right. So trying to tuck the pelvis, squeeze the butt cheeks, then give it a lift, making sure that the glutes are the primary movers here. And if you can hold it a few seconds, that's great too. When you're doing this exercise, those knees should stay apart. If you find that they're coming together, you're going to have to put extra emphasis on pressing those knees apart, maybe putting your hands here on the sides for them to push into as you lift. That's going to help activate those gluteal muscles even more. The butterfly exercise is for external rotation. It's restoring that movement. And remember, as I said earlier, the hip joint here is very safe. As I take my hip outward, the ball is moving even more into the socket. So this is a very safe movement. And this movement is critical for later when you need to reach your foot. So allowing both knees to fall out and come back together. It's good to do both legs at the same time because the good leg is basically telling the operated leg, not bad leg, what to do. It's how our brain works. Always moving within a comfortable range. I don't advise on pushing and trying to get more at this stage. We're just trying to get things loosened up, reducing some of the inflammation that's going on through movement. Seated external rotation is important in order to be able to restore that normal movement of being able to reach your foot. This is a good way to start that, and it also helps to strengthen those gluteal muscles and the deeper hip muscles that are responsible for this action and to keep our pelvis level when we walk. So starting this without any type of resistance, again, just trying to get the movement going, you might find that the operated leg doesn't move as far as the non-operated leg. But moving them together, again, works your brain. Your brain learns, oh, you want it to move further. You can then advance this by putting some resistance, a resistance band around your thighs, but that would come later. Just restoring the movement pattern is the important part in this first stage of recovery. The heel slide up the shin is definitely a functional activity, as it's going to result in your ability to get that foot on the opposite knee in order to cut your toenails, put lotion on, clean your foot, put socks and shoes on, all those wonderful things. But you're not going to be able to do that right away. Having the other leg more straight, lowering the surface of the shin is going to help. And you'll start with something really small. You have to start somewhere, and eventually you'll be able to get it higher and higher. Now, this motion does not break restrictions. I am not crossing my legs. I'm rotating my leg outward, so that's actually putting it more into the socket, so I'm not at risk of dislocating. I'm not going past 90 degrees at the hip, and I'm not crossing my leg over midline. So this exercise, in most cases, does not break restrictions. As always, please check with your doctor in case you have some restrictions that are not the norm. Sit to stand is a very functional activity that we do many times a day, and it's a great way to strengthen up the legs and restore that movement. So every time you go to stand, think about how you're moving. You're going to be inclined to not lean forward enough, which is going to actually make it harder for you to stand. So it's important to have your feet well placed under or a little behind your knees, a little lean forward to get weight over your feet, and pushing up through your feet. If you notice your toes coming up when you come to stand, that's telling you you're not quite shifted forward enough. Your body is fighting the pull, that posterior pull, and trying to right you. So when you come forward, press through your toes and come up. And same when you sit down, hinging at your hips, lowering yourself into the chair, and not straightening until your butt hits the surface of the seat. Now, I know some of you are going to say, oh, but that's bending past 90. Yes, a little bit, but it's also a functional movement, and you're only going through that 90 degree for a moment. And you're not going very far past that 90. In 30 some years of therapy, no one has ever dislocated their hip when they've gone to stand up. None of my clients. Let me just put it that way. So coming forward, pressing up, making sure to squeeze those butt muscles and stand nice and tall, stretching these front muscles that can really tighten up after the surgery. And then sitting back down. Now, I would suggest that the first stage after surgery, those first maybe few weeks, that you use a chair that has arms in it. That's going to give you a little more leverage to come up. But then gradually, I'd like you to use those arms less, using the legs even more. Another thing about sitting, the surface that you're sitting on, be careful. I know a lot of people like to sit in those cushy recliners, and they're great for elevating your legs and kicking back. That's all great. But please make sure it doesn't swivel or rock, because those aspects of a recliner make getting up and down more difficult. I also discourage people from sleeping in the recliner. I understand those first couple of nights after surgery can be rough, and having that pull on the hips, very uncomfortable. But as soon as possible, get back to lying in the bed with your body as flat as you can. Because if you're sitting a lot after surgery, these muscles here, the hip flexors, are tightening up. And that's going to make it harder for you to stand straight, because there's going to be this pull, this tightness in the hips. So we want to start getting them stretched out, which is why it's important to stand and walk frequently through the day. I tell my clients not to sit any longer than an hour at a time. Whether they just stand and shift their weight around or march in place, just do the jig, or they walk around their home. Whatever they can do, but just stand up and stretch out every hour. Whether you're using a walker or a cane, or maybe even no device after surgery, you are likely still not walking with a normal movement pattern. And so these next couple of exercises are designed to help restore that normal movement. We want to reduce the limp. We want to get the leg used to taking weight. And we also want it to get used to taking a normal stride, a normal step, without compensating, without bending at the hips, taking short steps. We do that by starting to teach it how to move. If this is my operated leg, I'm going to start with just moving my foot forward and back. I'm not putting any weight on it really, I'm just tapping the floor. But particularly as I move it back, I am pressing my knee back a little bit to get a little stretch through the hip here. Those hip flexors tend to get tight. So moving forward and back, and I really try to tighten those glute muscles as I press that leg back and then set it forward. I can progress this by shifting my weight. So as I put my foot forward, I'm going to shift my weight onto it. Then shift back, step back, shift my weight onto it. So my non-operated leg is not stepping, but my heel is coming up and then my toes are coming up to allow my weight to shift naturally. And it's really important that that posture stay upright, your hips are with you, as opposed to something like this, where you're keeping those hips flexed. We want to straighten up, tuck those hips in, stretch it out. It's also a good idea to do the reverse, where the operated leg is the still leg. The other leg now moves. This gets your operated leg used to taking weight, allowing your other leg to move more naturally. Going through that same progression of shifting your weight so that the operated leg can regain that stability. When I go forward like this, and this is my operated leg behind, it gives it an opportunity to get that stretch and then back. Sidestepping is another great exercise to help restore strength and stability in your glutes, in your hips. So facing a counter or a higher dresser, depending on your height, you may need something different. Just taking side steps, and they don't have to be big, keeping the feet facing straight ahead. It's important to go both ways because it works your hip in a different way. If I show you straight on, I want you to see how my hips stay level. So when I step, I put my foot down and I shift my weight and then bring that other leg in. I shift my weight, step, shift my weight, and step. I am not tipping to get the leg moving, because then you're using other muscles. We're trying to target in here. And keeping the toes straight ahead will keep us from cheating and using our hip flexors to move sideways. So the body needs to stay straight ahead, the toes straight ahead, and a small step. It does not have to be big. Some therapists will teach a side lift. I have learned that people cheat a lot with that exercise, particularly in the beginning. So I prefer that people start with the smaller movement of a side step. And it also captures the weight bearing and the weight shifting component. By lifting up out to the side like this, people tend to lift their hip up, tip themselves over, doing a whole lot of compensations. So I would suggest sticking with the side step with small steps. As you feel more comfortable, you can make them longer. Nothing wrong with that. As long as you're following those guidelines of keeping your hips level and only using your hip. So those are some exercises that I hope will help you get started on your journey after recovery from hip surgery, whether it's for yourself or maybe someone that you know that needs this guidance. But one other thing I want to talk about before we end today is using an assistive device. Many people like to get rid of the walker and the cane or a walking stick very quickly, whether it's vanity or just their belief that they don't need it. I do suggest getting some input from a therapist. Doctors are not the best guides when it comes to movement, unfortunately. They are great on the surgeries, but please leave the movement to your therapist. The danger to stop using a device too early on is that your hip is not getting the support that it needs. And if it isn't supported, then you're more likely going to continue with that habitual limp, which the longer it goes on, the harder it is to break. We all know habits are hard to break. And this one is important because if you continue to limp on this brand new hip that you just got that's supposed to make everything so much better, you're just going to end up with more problems down the road. So please take your time going through those assistive devices. Use the rolling walker until you can walk normally, not really putting weight on it. It's just for balance. Then try a cane and see if you can continue to walk without a limp. Once you can do that, try a little bit without the cane. And it's not a cut and dry. First off, I can't tell you how long it will be. Everybody is different. And secondly, every day may change. You may use the cane sometimes, the walker sometimes, and nothing other times. It's a gradual progression. The key is not to rush it. You committed to this journey by starting with this surgery, so why not do it right? Do all these steps, regain your flexibility, regain normal strength, and then you can regain normal movement. Not just ability to get across the room without pain. Can you do it without anybody seeing a weird walk? So there you have it. If you have any questions about your own precautions, I urge you to reach out to your physician or physical therapist you might be working with to ensure that you are following the right precautions, because it's not the same for everybody. And I do advise people who've had a hip replacement, while it's great to support others, please keep in mind that their precautions may be different than yours. So it's important that everybody seek out their own professionals to learn their own bodies, their own precautions, so that everybody can heal in the safest way possible. I hope this helped you. If you know someone who's going to go through a surgery soon, please share this with them so they have an idea of what to kind of look out for and what to start with, especially if that person is not getting therapy. And if you are one of those people who never got therapy after your hip replacement, please consider starting with some exercises like I showed you here, and maybe even requesting therapy if you don't feel like you're moving at your maximum potential. So I hope it all helped, and I'll see you next time.
Thanks for joining us today. If this episode helped you learn something new, we hope you'll share it with someone who could benefit as well. Until next time, keep moving, stay strong, and take care of your body.